Heart failure, also known as congestive heart failure, is a long-term condition in which your heart can't pump blood well enough to meet your body's needs. To properly diagnose heart failure, your healthcare provider examines you and asks questions about your symptoms and medical history. Your provider checks to see if you have risk factors for heart failure, such as high blood pressure, coronary artery disease, or diabetes. Your care provider listens to your lungs and heart with a device called a stethoscope. A whooshing sound called a murmur may be heard when listening to your heart. Your provider may look at the veins in your neck and check for swelling in your legs and belly. What are the tests used to diagnose heart failure? The following are the tests used to diagnose heart failure. 1. Chest X-ray. X-ray images can show the condition of the lungs and heart. 2. Blood tests. Blood tests can help diagnose diseases that can affect the heart. Blood tests also can look for a specific protein made by the heart and blood vessels. In heart failure, the level of this protein goes up. 3. Electrocardiogram, ECG, or EKG. This quick and painless test records the electrical signals in the heart. It can show how fast or how slowly the heart is beating. 4. Echocardiogram. Sound waves create images of the beating heart. This test shows the size and structure of the heart and heart valves, and blood flow through the heart. 5. Ejection fraction. Ejection fraction is a measurement of the percentage of blood leaving your heart each time it squeezes. This measurement is taken during an echocardiogram. The result helps classify heart failure and guides treatment. An ejection fraction of 50% or higher is considered ideal, but you can still have heart failure even if the number is considered ideal. 6. CT scan of the heart, also called a cardiac CT scan. This test uses X-rays to create cross-sectional images of the heart. 7. Heart MRI scan, cardiac MRI. This test uses magnetic fields and radio waves to create detailed images of the heart. 8. Coronary angiogram. This test helps spot blockages in the heart arteries. The healthcare provider inserts a long, thin flexible tube called a catheter into a blood vessel, usually in the groin or wrist. It's then guided to the heart. Dye flows through the catheter to arteries in the heart. The dye helps the arteries show up more clearly on X-ray images and video. 9. Myocardial biopsy. In this test, a healthcare provider removes very small pieces of the heart muscle for examination. This test may be done to diagnose certain types of heart muscle diseases that cause heart failure. 10. Exercise tests or stress tests. These tests often involve walking on a treadmill or riding a stationary bike while the heart is monitored. Exercise tests can show how the heart responds to physical activity. If you can't exercise, you might be given medicines during or after testing for heart failure. Your healthcare provider may tell you the stage of the disease. Staging helps determine the most appropriate treatment. What are the symptoms of heart failure? Symptoms may develop slowly. Sometimes, heart failure symptoms start suddenly. The symptoms of heart failure may include fatigue, sudden weight gain, a loss of appetite, persistent coughing, irregular heart rate, heart palpitations, abdominal swelling, shortness of breath, exercise intolerance, leg and ankle swelling or abdomen, sleeping on extra pillows, getting short of breath while lying down, protruding neck veins. When to see a healthcare provider. You should see a healthcare provider if you think you might have symptoms of heart failure. Call 911 or emergency medical help if you have any of the following: fainting or severe weakness, chest pain, sudden, severe shortness of breath and coughing up white or pink, foamy mucus, rapid or irregular heartbeat with shortness of breath, chest pain, or fainting. To learn more about the causes and treatment of heart failure, check out the link in description. Like and subscribe to this YouTube channel.